650 cases are there in the community which is unreported. So that is the importance of learning about hepatitis B. And people die, as I told you, 700,000 people die every year, which is due to chronic active hepatitis, liver cirrhosis, and primary liver cancer. And I'll tell you that 80% of the liver cancer is due to hepatitis B. Now coming to the incubation period, the incubation period is 30 days to 180 days, which means on exposure to hepatitis B, what is the time taken for you to develop the symptoms? That is what is called incubation period, and that is between 1 month to 6 months. So remember that when we think of hepatitis, we know we have a lot of hepatitis virus like hepatitis A virus, B, C, D. Okay, all these viruses are there. But what is the peculiarity of hepatitis B virus? It is the only hepatitis virus which is DNA virus among the family of this hepatitis virus. And as Sir rightly pointed out, that this is the global HBsAg prevalence, and we belong to the intermediate zone. That is, our prevalence of hepatitis B is between 2 to 7%. And see the countries of Africa, which is given in red, that is above 8%. Thank you, sir. So 2 to 7% means, that means out of every 100 people, there are 7 people with hepatitis B in our country. Okay, are you scared? Supposing I got infected with hepatitis B. I came to know through a blood test that, oh, I'm infected with hepatitis B. And I call everybody and say, oh, you know, I've got infected with hepatitis B. My life is gone. Should I say that? Is there a need to say that? Why? Could anyone please rise up and say why we should not be scared when you say that you're infected with hepatitis B? Okay, so let me give you the answer. Among the acute hepatitis B cases, thankfully, 90% of the infections, they resolve by itself. That means after 6 months, you will be completely cured of it. Okay, 1% goes for fulminant hepatitis. That means they will have severe hepatitis and they will die, except until you do liver transplantation. Otherwise, it ends in death. And the rest 9% of people are the ones who may have HBsAg positivity for more than 6 months. And thankfully, among that, 50% will undergo spontaneous resolution. But 4.5 to 5% of the people, they will have chronic persistent hepatitis or chronic active hepatitis, which means that if 100 people are in this room today and they are infected with hepatitis B, right? 5 of you will develop chronic hepatitis, just 5 of you. 95% of you will get cleared of the infection in 6 months. Got it clear? So, what is the problem with this chronic active hepatitis? It leads to cirrhosis of the liver. Have you heard of a condition, cirrhosis of the liver? Cirrhosis of the liver and HCC, that is hepatocellular carcinoma. So this is a figure to show you, just to make you understand how the healthy liver progresses to chronic hepatitis. You see cirrhosis where there is a nodular liver, and finally one of the nodules they develop hepatocellular carcinoma. Okay, but it's just in these 5% of the cases who are chronically infected. Got it? Yeah. Now coming to the symptoms of hepatitis B. So what could be the symptoms of hepatitis B? You could have fever, jaundice, dark urine. Okay, you could have nausea and vomiting, loss of appetite, joint pain, hives. What is hives? Itching sensation and redness over the body, headache, weakness. All these could be the symptoms of hepatitis. You could have a few and not have the rest of it. And sometimes people will not even have any of these symptoms. Got it? Okay, so that is about the symptoms of hepatitis B. Now, coming to the peculiarities of hepatitis B virus, I want you to understand this very carefully. The hepatitis B virus is one of a very resistant virus that can survive outside the human body on environmental surfaces for at least 7 days. What does that mean? It means that in the absence of visible blood, it will survive on environmental surface for 7 days. That means if suppose I had hepatitis B and my blood was drawn and unfortunately some blood dropped on this table, somebody comes and wipes it off. Still the virus can be there and can survive for 7 days. And remember that it is 100 times more infectious than HIV virus. It is resistant to water at 60 degrees Celsius for 10 hours. And it is, however, susceptible to boiling water, 2% of glutaraldehyde, and phenolic disinfectants. Generally speaking, everything that inactivates a tuberculosis bacteria will inactivate hepatitis B virus. Clear? It is a very resistant virus. Now coming to the main talk of the day, that is transmission of hepatitis B. How could one get hepatitis B infection? Firstly, it is through birth. That is, an infected mother can transmit the virus to her child. Sex with an infected partner, sharing needles, syringes, or even other drug preparation equipments. When I speak of this drug preparation equipments, I read an article on which they studied about the prevalence and transmission of HIV among a group of intravenous drug abusers. And they gave them needles and syringes through the needle exchange program, and still it was found that there was no decrease in the prevalence of HIV amongst these IDUs, intravenous drug abusers. So everybody was surprised, why not? Why there wasn't a decrease? The reason for that is the drug preparation equipment they used was the same. So that was a reason why there was no fall in the prevalence of HIV. Okay, so the drug preparation equipment, sharing items such as razors, toothbrushes, medical equipment such as, the blood glucose monitors we use for testing diabetes, those. Direct contact with the blood or open sores of an infected person and exposure to needle sticks or sharp instruments can all lead to getting hepatitis B infection. Are you clear on it? So, see, sharing toothbrushes and razors all can lead to hepatitis B infection. In short, hepatitis B transmission can be divided into perinatal transmission and horizontal transmission. When a mother transmits hepatitis B virus to her child, it is called perinatal transmission. And when somebody, an adult with hepatitis, transmits it to others, it is called horizontal transmission. And I would like to say a very important and a very interesting fact to you. It is that if a person is infected with hepatitis B during childhood days, or for example, during infancy, there is 90% chance that he becomes a chronic hepatitis B carrier. So as age advances, the chance of you to become carriers increases or decreases? Increases or decreases? Yes, tell me? Decreases. Okay, so when you are an infant, if you get hepatitis B infection, the chance of you to remain hepatitis B positive or a carrier is 90%. And it drops to 50% when you get the infection between 1 to 5 years of age. Got it? So the chance of you remaining a chronic carrier is only 50% between 1 to 5 years of age. And see, if you had listened to my earlier slides carefully, when you become an adult, how much percentage remains as chronic hepatitis B carriers? Very good, 5%. So only 5% develops a persistent hepatitis B if they get the infection in adulthood. Clear? Yeah. So now coming to the concentration of hepatitis B virus in various body fluids. Blood serum and wound exudates are said to have high concentration of hepatitis B virus, while semen, vaginal fluid, and saliva, they have moderate concentration, and low or not detectable concentration is found in urine, feces, sweat, tears, and breast milk. Okay, and remember that hepatitis B is not spread through food or water, sharing eating utensils or drinking glasses. It is not spread through breastfeeding, hugging or kissing or hand holding, or even coughing or sneezing. It is not spread. Got it? Can it be spread through breastfeeding? I've searched many articles and they said that even before the introduction of hepatitis B vaccine, the chance of spreading through breast milk was almost nil. Okay, and since we have hepatitis B vaccine now at birth, there are actually no chance of spreading through breast milk. Got it? Yes. Now let me ask you a few questions to make you understand certain things. Can a person spread hepatitis B virus and yet not know about it? Can a person spread hepatitis B virus and yet not know about it? That's my question. Hepatitis B virus undennu ninke ariyade, can I be able to spread it? Yes, very good. Because what's the reason? Many people, as I told you, many people with hepatitis B viral infection, they do not know they are infected because they do not feel sick or they do not look sick. However, they can still spread the virus to other people. Are you clear? Yes. Now, how do you diagnose hepatitis B? So, diagnosis of hepatitis B is based on certain antigen and antibodies in blood. So we do a blood test. Okay, we do a blood test. So if the person is hepatitis B, HBsAg positive, what does that mean? HBsAg is an antigen on the surface of hepatitis B virus. So if a person is HBsAg positive, what does that mean? That person could have an acute or a chronic infection. It could mean both. What about HBeAg positive means? What does that mean? The person has got active viral replication. And what is HBV DNA? If a person has HBV DNA in blood, what does that mean? That means too that the person has actively replicating virus. Okay. And what does anti-HBs mean? That is antibody to HBsAg. What does that mean? If that is found in the blood, what does it mean? The person is recovered, or people like you and me are having anti-HBs. Why? Because of immunization. And what does anti-HBc mean? Anti-HBc means you might have a current infection or it must be a past infection. So these are some of the very easy way to interpret the viral markers. Understood? Are you clear on it? If you have any doubts, please stop me and ask me. Okay. Now my next question to you is, how long does it take for blood to test HBsAg positive after exposure to hepatitis B virus? How long does it take? So what did I tell you the incubation period is? 30 days to 180 days. So what did I tell you? What is the meaning of incubation period? From the exposure to the virus to the onset of symptoms. But my question is, from the exposure to the virus, how many days it will take for you to be tested as HBsAg positive? How many days? So the answer is, it will take an average of 4 weeks. Okay, it will take an average of 4 weeks, and the range is you can be positive anywhere between 1 week and 9 weeks. And all patients who do not remain chronically infected, that is those who will not progress to a chronic infection, they usually clear their HBsAg from blood within 15 weeks of symptoms. So once they have symptom and you test within 15 weeks, and if you are HBsAg negative, that means you're not going to be a carrier. But if you be HBsAg positive, that means that you could be a carrier. That is, you could come in the 5% group who could tend to be carriers. Are you clear? So what is the treatment of hepatitis B? Treatment is all just one slide I've kept for it. So what is the treatment? Tenofovir is the treatment. Don't be surprised, it is the same drug which we used to treat HIV. It's the same drug which we used to treat HIV. So what is the treatment in acute infection? In acute hepatitis B infection, what's the treatment? Nothing. That's the answer. It's just rest, adequate fluids, and adequate nutrition. Okay. And in chronic hepatitis B, depending on the situation, whether you have a chronic active hepatitis, we need to go for interventions. And remember that once you start treatment for hepatitis B, what is the criteria? You will have to take medication for life. Are you clear on that? Yeah. Now coming to levels of prevention. Okay, now my main talk of today is on preventing hepatitis B and the questions related to that. So what does primary prevention mean? What is the meaning of primary prevention? Primary prevention means it is the preventive measures that you take before acquiring the disease. That is, before you get infected, what are all the measures to be taken to prevent hepatitis B? So that is called primary prevention. So what are the measures? Awareness and education. Like how sir asked me to do a presentation today to educate you, that is what is exactly to be done to prevent hepatitis B. Education. Vaccine. Blood safety practices, safe sex practices, safe injection practices, occupational safety, and harm reduction in injection drug users. So these are all the primary levels of prevention. See, you have a hepatitis B vaccine, which is a very safe and efficacious vaccine against hepatitis B. Now you might be wondering, who all should take this hepatitis B vaccine? Can you give a guess? No need to guess, it's written there. Okay, so the government of India has introduced the hepatitis B vaccine in 2003, and thereafter all infants were to be immunized with hepatitis B vaccine. So all infants and adolescents who are not previously vaccinated, people like us who have occupational risk, hemodialysis patients, recipients of blood and blood products, injection drug users, susceptible, if somebody is living with you who has got a high-risk behavior, you better take vaccination. Got it? Household contacts of hepatitis B and sex partners of hepatitis B. As sir said, population with a high incidence of hepatitis B in countries like Africa, everyone is supposed to take it. International travelers to high-risk areas, transplant candidates, those people with HIV virus, hepatitis C infection, those who are in jail, okay, or prison, and people with diabetes. They are all supposed to take hepatitis B vaccination. You might be wondering, why diabetes? Right? Right? Why? So, as I unfold the latest part of the story, you will understand it. But for now, just remember that, they are the ones who get frequently blood tested and they have to take blood, right? So they have to get insulin for their injection. So they are more prone to, suppose they can acquire infection. So they have to have hepatitis B vaccination taken. Now, can anyone tell me the hepatitis B vaccination schedule? Yeah, it is correct, 0, 1, and 6 months. That is the first dose, if you take it today, you have to take the second dose after 1 month, and the third dose 5 months after the second dose. Okay, so that is 0, 1, and 6 months. So what kind of injection it is? It is an IM injection. It is given intramuscularly into the deltoid, and protection. There is 95% seroconversion for this vaccine if you give it in infants, children, and young adults. What does that mean? Infants, children, and young adults, there is 95% seroconversion. What does that mean? Could anyone give a guess? That means, what about the 5%? What about?
They don't develop adequate antibodies.
Yes, sir. They don't develop adequate antibodies. 95% say, I'll tell you the reasons why they don't develop adequate antibodies. And one more thing is that when you are an adult above 60 years of age and you take hepatitis B vaccination, you might not develop the seroconversion. That means you might not develop antibodies against hepatitis B virus. It is said that only 40% of people above the age of 60 years, they have adequate seroconversion. Got it? Yeah. So it is given as an intramuscular injection. The dose is 1 ml in people above 19 years of age and 0.5 ml in those below 19 years of age. And there is something called as accelerated schedule. Okay, that means apart from the 0, 1 and 6, you will have 0, 1, 2 and 6 months there is an injection, and that is for immunosuppressed patients and those undergoing hemodialysis. Got it? Are you clear? Yeah. Now, what are the factors for the decreased vaccine response? Do you remember I talked about the 95% seroconversion? So why isn't that 5% of people, they don't respond to the vaccine? So these are certain reasons why they have lower response to the vaccine. That is smoking, obesity, HIV infection, any immunocompromised patients, patients on hemodialysis, patients with chronic diseases, any chronic diseases, genetic factors, premature infants. If you give hepatitis HBsAg vaccine, hepatitis B vaccine, they might not respond. And some other factors pertaining to the vaccine. If it is given as a subcutaneous injection, what did I tell you is the route? Intramuscular. Suppose you had given it subcutaneously, people will not respond. Freezing of the vaccine. Hepatitis B vaccine should not be freezed. So if a frozen vaccine is given, it is of no use. And accelerated schedule. Accelerated schedule, if you give frequently, that 6 months gaps is enough. The 5 months gap after the second dose is required. So if you give it before that, they might not respond adequately. Are you clear on that? Okay. Now, one more question I have. Is it harmful to take an extra dose of hepatitis B vaccine? Or another question. Is it harmful if you repeat the entire hepatitis B vaccine? Is it harmful? Or supposing one person has taken hepatitis, the second dose of hepatitis, and it's been 9 months after taking the second dose of hepatitis B vaccine. So what should you do in that case? Should you restart the vaccine? Should you? I didn't understand. Look at the titer. No. Very good. You should immediately give the third dose. You need not restart the schedule, however long is the time period between the doses. So you should just give the missed dose. Do not restart the schedule. Okay. And yeah, the series does not need to be restarted. And my question still stands. Is it harmful? Supposing you have started, is it harmful to get an extra dose of hepatitis B vaccine? No, it is not harmful at all. Now my next question to you is, can hepatitis B vaccine be given during pregnancy or lactation? Why? Why? Hepatitis B vaccine is what kind of vaccine? It is a live viral vaccine? Is it? It's a killed vaccine? Is it? It is a recombinant vaccine. It is a recombinant vaccine. It's not a live viral vaccine, so it can be given in pregnancy and lactation. Now, another question for you is, recombinant, it is not a live viral vaccine because live virus is the one that is harming the fetus. For example, you're not supposed to have a measles vaccine or a rubella vaccine if you are pregnant or if you're planning for a pregnancy. Because why? It is a live virus, and live virus can cause problems to the fetus. So otherwise, recombinant vaccines, they are made in yeast cells by recombinant DNA technology, and they are not harmful during pregnancy. Clear? Okay. Now my next question to you is, why did I put these slides as questions? Because if you put it as questions, you will remember it. You might take a moment to think and you will remember it. If I just keep on blabbering, I don't think you will remember half of what I speak to you today. So that's why I thought of putting it as questions. Now my question for you is, should persons be tested for immunity to hepatitis B before being vaccinated? That means before giving this hepatitis B vaccine, should I test them and make sure that you are HBsAg negative? That's my question. Should you? If you say yes, you must tell me the reason. So, nobody is going to get up. Yeah. Can anyone give it a try? Please. Okay, so I might as well give the answer. See, this HBsAg testing is done not to see whether you are hepatitis B, or okay, it is to see whether you are hepatitis B infected or not, but the actual reason for doing it is that you can link to appropriate counseling, to care and support and all that. Okay, and suppose a person is infected with hepatitis B virus and he has an infection, and there is no problem if you give hepatitis B vaccine to that patient. There is no increased risk of adverse events. Okay, so even if I have hepatitis B, if I am vaccinated, there is no increased risk of any adverse events. Are you clear now? Okay. Now, my next question is, always I'll be speaking to you after giving the question. Can anti-HBs levels following vaccination decline over time? Can it? Can it? Say yes or no? Yes. Okay. If so, what can be done about it? Should I take another booster vaccine? Should I? Should I? No. So it's like suppose you take the full dose, 0.16 dose of hepatitis B vaccine. And the ideal time to get your anti-HBs titer is 1 to 2 months after your last dose. And if even on a single recording, if your titer, the anti-HBs titer, is about 10 milli-international units per liter per ml, that means you are adequately protected for lifetime. You are adequately protected for lifetime. Even if there is a decline in the anti-HBs levels to less than 10 milli-international units per ml, but because of the persistent cellular immunity, you are protected. So don't worry and say that, oh my God, 2 years back I tested and I was above 10, and now I tested and I'm below 10. Should I take a vaccine? No. You need not take a vaccine. You are protected because of your cell-mediated immunity. Okay, can I move on? So the answer to my next question is already given. So are booster doses of hepatitis B vaccine recommended? If it is 0, in the sense, if you have one recording about 10, that time 0, then that means you did not respond adequately to the vaccine, so you are supposed to take another booster dose and have your titer checked. Even if still after that your titer is still below 10, you have to complete one more full series 0, 1 and 6 with hepatitis B vaccine. Even then you checked 1 to 2 months after the second full dose you check, and even if you are still below 10 milli-international units, that means you are a non-responder. You are a non-responder. I told you the reasons for your non-response, right? You might be belonging to one of those categories. Okay, so the question is, are booster doses of hepatitis B vaccine recommended? Tell me. No. Okay, but I'll tell you, yes. For whom? Not for people like you and me, but for patients undergoing hemodialysis and other immunocompromised patients. So how frequently should you test them? How frequently should you test them? Annually, okay? You should test them yearly, okay? And so my question immediately on reading this verse, so what is the maximum hepatitis B doses that can be given to such patient? What is it? You tell me. If I suppose I am on hemodialysis at age 40 years, and you say that I have to be annually tested, and if my titer is below 10 milli international unit, I have to get vaccine again and again and again. So how many vaccines will I get? Is there an upper limit? No. You can get as long as you live. Got it? You're clear on that? Yes. Now, supposing you are exposed to the hepatitis B virus, what should you do? You're exposed to the hepatitis B virus, what should you do? So immediately, within 24 hours, you have to get your hepatitis B vaccine and your hepatitis B immunoglobulins. Okay? Hepatitis B vaccine and hepatitis B immunoglobulin. Okay? So, provided that you are not been vaccinated before. Understood? And you have to continue your full dose of hepatitis B vaccine. Understood? Yeah. Now my question, I forgot to put the question. If you sustain a needle prick injury and you're not vaccinated, okay, what is the chance that you get hepatitis B? When I was sitting as a medical officer of Kottayam Medical College Preventive Clinic, I used to, every day at least 3 people will come to me with a prick, with a needle prick. They'll be like, ma'am, everything is gone, ma'am. What to do? So if you sustain a needle prick, what is the chance that you can have hepatitis B? Will all people develop hepatitis B? No. Okay. So it depends on your HBsAg status and your HBeAg status. So, if your HBsAg and HBeAg are positive, what does HBeAg stand for? What does it stand for? Active viral replication. So, if both the combinations are there, then you are at an increased risk. That is, you have about 62%, the higher limit is 62% chance of developing hepatitis B. But if the person is HBsAg positive and HBeAg, that is negative, that means he doesn't have active viral replication, then your chance of getting hepatitis B is as low as 37%. Am I clear? Okay. If a pregnant woman has hepatitis B, my question is there any way to prevent the hepatitis B in the newborn? Think. Is there? Suppose I have hepatitis B and I badly want my newborn to be free of infection. Is there any way? Yes, there is a way. So the way is, the infant should receive hepatitis B immunoglobulin and the first dose of hepatitis B vaccine within 12 hours of birth. So if within 12 hours of birth, if the child receives both immunoglobulin and hepatitis B vaccine, provided that the hepatitis B schedule is continued, then there is no chance that the baby will develop hepatitis B. Understood? So these are all about general information on hepatitis B vaccines and all. If you have any doubt on these vaccines and all that, you can ask me. Okay. Now, one more point which I have to mention in primary prevention is, how should blood spills be cleaned from surfaces to make sure that hepatitis B virus is gone? For how many days did I tell you that hepatitis B virus survives? 7 days. And did I say that the hepatitis B survives in the absence of visible blood? Yes, it does. So how should blood spills be cleaned? Very good. It should be cleaned with phenyl. Suppose phenyl is not available, then So the recommendation is all blood spills should be cleaned. Before putting any disinfectants, it should be cleaned with water. Then it should be disinfected with a mixture of bleach and water. 1 cup of bleach and 10 cups of water. So 1:10 ratio bleaching powder you should use to clean it, and leave it for how many minutes? That is important. 15 minutes. 10 to 15 minutes you have to leave it. And you wear gloves while cleaning any blood spills, and because even dried blood can be infectious. Got it? Yeah. Now we are coming to the end of the topic. So secondary prevention. Coming to secondary prevention. What is the meaning of secondary prevention? Don't read what's given there. What is the meaning of secondary prevention? Secondary prevention means, after all, despite of all these efforts, I got hepatitis B. I got it. Now, at this stage, what can be done to prevent the further worsening of the disease? So what are the measures taken to prevent the further worsening of the disease? That is called as secondary prevention. So if you know you are hepatitis B infected, you could abstain from alcohol, tobacco, and drugs toxic to the liver. You can seek early treatment which prevents the progression to cirrhosis of the liver. So all these comes under secondary prevention. And above all, you can take measures to prevent others from getting it. Got it? Now, I want to tell you that hepatitis is preventable, it is treatable, and hepatitis C is even curable. However, only 80% of people living with hepatitis, over 80% of people living with hepatitis are lacking the prevention, testing, and treatment services. Got it? That's the amount of response. More than 80% of the people, they don't know. They are living with hepatitis, they don't get proper treatment, they have nothing. So what was the World Hepatitis Day 2019 theme? What was it? What was it? It is invest in eliminating hepatitis. Invest in eliminating hepatitis. Why? It is the second major killer after tuberculosis, and 9 times more people are infected with hepatitis B than they are infected with HIV. It is the second most killer disease. Okay, sorry. When was the Hepatitis Day celebrated? I know you all saw it. You all saw it. When was it celebrated? I know you didn't get time to read the rest of it. So why is 28th July chosen as World Hepatitis Day? Why is it chosen like that? Just tell somebody, one Nobel Prize winner's birthday. Is it? Is it? Yeah. Yes, it is the birthday of the Nobel Prize winning scientist Dr. Baruch Blumberg. He was a person who found the hepatitis B virus, who even developed a vaccine against it and diagnostic test. It was everything he did it. So in order to honor him, we celebrate 28th of July as World Hepatitis Day. Now, WHO, we know that, have you heard of SDGs, Sustainable Development Goals? So the WHO's Sustainable Development Goal by 2030 is that raising awareness, promoting partnership, and mobilizing resources to eliminate hepatitis. They are formulating evidence-based policy and data for action. They are preventing transmission, and they are scaling up screening, care, and treatment services. So all this is done for what? To attain the theme, that is, invest in eliminating hepatitis. Because why? Hepatitis B is preventable. It is preventable and treatable. Got it?